This is the Nairobi Ideas Podcast, a podcast that gives a public platform to the Africans changing the world with their big ideas. I'm your host, Kare Mugo of the Mawazo Institute. Thank you so much for being on the podcast today. If you could please introduce yourself to us and our listeners.
Thank you, Kari. Hi, everyone. My name is Yariwo Kitiyo. I work as a co-founder for Women in GIS Kenya, where I lead the data and innovation arm of the initiative. Yeah, that's by night. During the day, I work as a full-time spatial data analyst within an LPG farm here in Kenya. Really excited to be here. I have a background in environmental sciences, and I'm currently pursuing my master's in geographic information systems and remote sensing. Now, that's a bit loaded, but I'm pretty sure we'll get into it with Kari on what all that entails and how we are using that bit of my background to basically support policy here in Kenya and use of data.
Absolutely. I'm very excited to talk to you. So we asked you to the podcast basically to help us understand how scientists and governments are using COVID-19 data to do a number of things. And that means, understanding the impact of the pandemic across different demographic groups. We're looking at mapping infections. We're looking at, how are people uptaking the vaccine. And I remember very early on in the pandemic, there was this thing that would happen in Kenya where, the CS for health would come in front of some TV cameras. He'd be surrounded by people with masks and he'd read off numbers for us that were just very damning and also felt very anxiety inducing. And so I wanted to maybe start off by asking, what kind of data are we currently collecting about COVID-19 aside from what we know, which are infection rates? What else is the universe of data that is being collected around the virus?
So locally, I think I'll start with Kenya, and then I can give other examples outside Kenya. We had a privilege of supporting Ministry of Health right at the onset of the virus when we had the very first infection in Kenya. I think that was around 12th March. And some of the attributes that the government is collecting around COVID would be, initially we started with mainly the infection rates, number of cases, deaths. And then with time, after a couple of days, we started getting information around, is it an imported case? Is it a local case? It split down by gender to just understand what's happening. And also what's really interesting that government was able to capture and is still doing is the county from which these cases are coming from, to just be able to understand how the disease is spreading spatially or across space. So that's also information that government is currently collecting. And I think that has grown. Maybe globally, the CDC, which has also been really useful in terms of just for the scientific community to get data, is some of the information they're also collecting is the infection rate. So this is like the infection rate per 100,000 people for you to understand how it's spreading across different populations across the world. That's also pretty useful, which was really interesting because that gave us perspective locally, even with when you're working with Ministry of Health, to just have a side-by-side view of what's happening locally versus what's happening globally. So that would be some of the information that the government here is actually collecting around COVID-19 infection.
And a thing that I was very attracted to when we first started talking was the idea of, GIS mapping, which is this concept I came to, I think, mostly through you and our previous engagement when we were working on Breaking Barriers, which was an ebook that was chronicling or that was profiling young Kenyan female scientists who we felt were the next generation of leaders in their fields of practice. And GIS mapping, I think, is something that I really began to understand through the work that you were doing. And so if you could maybe, for our listeners and myself, just a quick refresher, what are we talking about when we're talking about GIS technology?
So that's a pretty new niche, especially in Kenya, because most of the time when I meet people and I talk about GIS, everyone asks me, oh, wait, did you study in Kenya? So it's actually a pretty new, not really new, but it's not well known across Kenya. And what GIS basically does, or what it builds upon or on top of, is space. Everything exists in space. So everything we build is sort of built on top of that. So what it answers, the first thing it answers is the where. So it can be, where is the disease? Where do you live? It's basically a technology or a tool that's powering up all the location-based applications we're seeing across the globe, from things like Uber, and now it's even getting into health, which has been there for a while. It's just that now, amid the pandemic, the use of GIS, there's a survey that said it's grown by 100% because of how it's very important for us to understand how things exist in space, because this is how you understand how a disease is spreading and how it's affecting different populations across different dynamics. So that's what GIS is. it's an information systems that builds on location, and on top of that we get to understand. So in an instance of COVID, it's where do you live, and then we build on top of that, right? The people around you, the characteristics of people around you, are there health facilities around you? So we build now all the attributes are built on top of the location layer. That's what GIS essentially is.
When you're talking about space, I just want to be clear, we're not talking about, outside of the earth, like the spaces that we exist in here and geographies. And I think a thing that was really helpful for me in thinking about GIS, and as you talk about the layering, is that you have, this is the geography of the place, and then you learn this other data about gender, and you put that on top of that, and then you get other data about, say, age, and it's just basically layering a bunch of maps to learn as much as we can. And there's some really helpful visuals out there if anyone is really struggling with understanding the concept of GIS technology.
That's pretty much it. Now we use this information. What happens is we are trying to change how we look at data, and now we are combining what you've just explained. So, like, for example, if I'd give an example of Kenya and currently what we have, and we did that initially with the Ministry of Health, was creating a map to show a vulnerability index across the country. And this means when you talk about vulnerable populations, what factors are we looking at, right? So we basically created a composite where we've shown maybe a hotspot regions across the country. These are like places that need a lot of attention or places that are least vulnerable. So you basically get a map that's able to inform you and inform the government or where they can prioritize efforts or have resource prioritization efforts. So that's basically it around how the map is very useful.
Looking at Kenya and COVID-19 infections, you were part of a team that helped the country's Ministry of Health develop its COVID-19 dashboard. Can you tell us a little bit about this project and why it was important to you to get involved at this level?
Last year was one of our biggest years because this is where we actually got to work with government and the presidential advisory team to just help government make informed decisions about COVID and just visualize that information. And this was a very organic relationship that formed between ourselves and a couple of partners, JQuat included, Palladium and Ministry of Health. And what happens is there was a need because essentially when the CS of Health is making a press release on the number of infections, then the government will release it through a PDF. And this happened for a couple of days, and that's when you realized, there's a need. Because now there was already conversation around the community, the data community and scientists and researchers on does anyone have these numbers? And that's when you realized as the days kept getting longer and the cases kept becoming more, what we noticed is there's a need, there's a gap for us to have data that's very palatable for researchers to use it and anyone else who wants to create around it and study the disease and how it's spreading. So that's how we initially started transcribing or just typing in, going to the MOH website, then having an open Excel sheet right next to it and just typing in the numbers as Kagwe or as the ministry has put it on the press release. So what happens is the numbers would come in and then we'd project that on a dashboard because we immediately noticed there's a need for even the community and a community engagement platform where we could all see the numbers. We could see how your county is doing. And that's what the dashboard was about. It's for you. It's to give insight to the public at a glance what's happening, but also to the government because normally as soon as you see a dashboard where you have charts, graphs, there's a map showing you areas that are mostly affected, then information is well communicated as opposed to a PDF. And that's why we needed that, to just socialize the data, but also being able to have other researchers and any other person who'd want to plug into the data and use it for something else would be able to have access to it. So that was what inspired us to now have a public-facing dashboard for the public hosted on the Ministry of Health website.
Just for our listeners who are outside of Kenya, JKUAT is one of the main universities in Kenya. It's the Jomo Kenyatta University of Agriculture and Technology, and it has an amazing team of researchers across various colleges. If I can summarize what you're saying that basically there was this data that was coming out of the Ministry of Health, but it's not really helpful when you just have one long Excel sheet or one long document. And so what can the data tell us is what you were trying to figure out and help the ministry find a way to do that in a way that was concise and also would be much more useful to many more people. And so when you first are analyzing this data from the Ministry of Health, what are some of the things that surprise you or what are some of the findings that come out of this? I know earlier on you had talked about vulnerability index or something similar to that. So If you could just talk to us a little bit more about the kinds of things you were finding in the data.
So I'll touch on the three different engagements or applications we worked on for the Ministry of Health in collaboration with all these partners. The first one was a dashboard, mainly to visualize what's going on, the statistics, the numbers. It was actually a very interactive dashboard where I could go pick my county and see all the stats, the number of deaths, recoveries, all those numbers would be attached, and it would be a very interactive dashboard for the public to work with and even for the ministry. And then the second component of the engagement was now the risk map. And this is where the analysis came in. It was basically an algorithm or a set of rules that would enable government to see where vulnerable populations are. And we used some of the WHO principles or guidelines around what defines a vulnerable population. So things like access to sanitation, social distancing, manual labor, use of public transport. These are some of the variables we used. And what this means, I'll give an example. For example, public transport is we have data on public transport. And so what we are saying is people who use public transport are more at risk of getting exposed compared to people who use private transport. That's one example. Another example is if you're 60 years and above, then you're basically in the vulnerable population category. So we used all these factors all together, brought it together onto, I'll call it a scale. In analysis, we called it weighted overlay, I think. So weighting means we are giving it weights on a scale of 1 to 100. What is most important when you're weighing this? Which one is most vulnerable? Is it the 60-year-old guy? Is it the guy who's works in manual labor? Is it the guy who uses public transport? And all these are weighted, and then you create a composite. And a composite is like adding manual labor times the percentage it has plus this, divide by the number of elements you're using. And we used close to 100 factors across Kenya to understand vulnerable populations. So that was the second engagement. And your output is a map, again, which is like a computation of all these factors I've just talked about brought together. It's like an overlay of you're adding all these factors, then you get one map that shows you the red layers where you have. So the output would be, this is where you have 60 plus people. These 60 plus people are in manual labor. These people are the same people who use public transport. So yes, they are more at risk, and vice versa for all the factors. And this was very important. And one of the insights that came out from that would be, let me just explain one of the outputs we had is some of the areas that came out as very highly vulnerable, of course, were slum areas, right? Places like Kwajenga, these are places in Kenya. Huruma, these were places that were very highly vulnerable. Eastleigh, and this was obvious, right? Based on factors that surround these neighborhoods, there's very high population. This is where you have manual labor. This is where you have a lot of people using public transport, as opposed to now other leafy suburbs where you rarely have these factors coexisting together. For example, when you look at Nyeri, you have majority of the population being the elderly, right? So again, that also was something that came out within the risk map, where you find it's a highly vulnerable population that lives around that particular area. And what's also really interesting would be the inverse as well, where you have, for example, now areas like Turkana, Wajir would sort of also look now as less vulnerable areas. And this is because of one component that came into the model, and this was transport and accessibility, the number of people going in and out of a county. And this mainly is how connected is a county is. So the more connected you are, then the more exposed because of the number of people coming in and out. And I think you notice during last year, you noticed that some of the areas that were high risk were border towns, Busia, Malaba, and this is because, again, of the activities happening. There's also factors like, I think I've talked about most of the factors. There was access to sanitation, which is data, again, that we use. There's access to water. How do we put that within the scale? And I think what's really important that came out from this whole analysis is the importance of open data, and just researchers having data that they can actually work with that's complete, timely, and very available, and contains all the metadata they need for them to actually do analysis that would power up decisions across the country.
That's a very powerful statement you end in with there. And again, just some context for listeners outside of Kenya. Kenya is organized into a federal system. So there are counties where decisions are very largely independent of the national system. And so it's really important to have good, accurate data at the county level and at the national level, because there are whole entire different decision-making structures happening there. So you're talking about the concept of open data. And immediately my brain is just sparking. It's like, what is that? What do you mean when you say open data?
So what open data means is data that's readily available without necessarily you having to buy it, and it has less restrictions when it comes to reusing it, sharing it, and just being able to actually use it in a way that you're not very limited in using it as a researcher. Basically have a component of inclusion when this data is being shared by government or being shared by private entities. So what happens is you'd notice during the pandemic, I'll give an example of the project we are working on, is we needed data on what's the sanitation like in Kenya. We needed data on age breakdown for Kenya. Where do the 60 plus year old people live? Where do we have the smoking population? Where do we have malnutrition? This is all data that we need for us to do analysis. But what happens is most of the time you rarely find this data in open means you're not necessarily buying it. So you rarely find this data when you go search online to get it. And most of the time, it's data that's either collected by government or private institutions. So what this means is you've essentially been locked out of using that data because you either cannot pay for it, or you cannot use it in a way that allows you to manipulate it, or you cannot share it across different environments or across different users. So open data allows for that, and it also advocates for completeness of data, availability of metadata for the researcher to know how to use it and what the different components of the data represent. So that's essentially what open data is, use of data in a way that's very inclusive, very interoperable, and no one is locked out of basically consuming that file or consuming that data set.
If I'm just reflecting on the last year or so, what I've tended to see is a call for greater collaboration across countries, across, research fields, and it feels like that call has been answered. So I'm wondering if there is a trend towards more open data, at least in the very last year or year and a half.
Yeah, there's actually been a huge improvement in access of data and availability of open data. I'd probably reference, there's a McKinsey study that was done recently on how pandemics basically accelerate the use of technology. We're calling it tech acceleration. And what this means is pandemics have a way of probably making us jump 5 years ahead. Someone said we are currently in, what's 2021 plus 5? We are currently in 2026, right? Because of what this pandemic has done. And this is the same thing that's happened with data. So I'd probably give examples locally, especially on some of the things or some of the websites that have really changed how we are using data. This data that's open. And one of them would be there's a website called Frame, which is a company, it's a private company. These guys normally sell data. Now, what happened last year as soon as the pandemic hit, they made most of their files open. This is high-resolution data. By high-resolution data, I mean you're able to look at sanitation across Kenya, who has access to sanitation, at literally ward level. Ward is like the least possible administrative unit in Kenya. This is data that you would have had to buy. So what Frame did is they made this data open, right? Most of our variables actually came from them. And then there's also other sites like Health Survey for Kenya, right? The Demographic Health Survey. That's also a site that's been very useful, that we are also able to get some of the variables from to use for the analysis. So the pandemic has definitely changed how organizations are looking at open data and how they're embracing and just giving access to researchers, tech people to be able to use this data and drive innovation across the globe and even locally here. So I'd say there's definitely been a huge improvement. That's like a plus that we've had as a technical community across this region. Yeah.
I'm really interested to pick out, the positives of the pandemic, because it can be very bleak to think about the losses that people have suffered interpersonally, economic losses to, mental and emotional well-being. And so when I have these insights into, okay, things are changing towards a good, it feels really nice to actually be able to pull that out and tease that out. So thank you for sharing that with us. So in episode 1 of the podcast, we were looking at the region's vaccine rollout. And I know that you currently have a project that is also looking at vaccine uptake. And I was wondering if you could tell us a little bit about that project.
Yeah, so we currently, and by we, I mean Women in GIS Kenya and a couple of partners. These partners are from the Climate and Health Initiative Alliance. This is a global alliance for different universities across the globe. There's also KEMRI here locally. There's geospatial here locally. And then the other partners, external partners who are within that alliance. And currently have a project that's in the pipeline. We already did a position paper on it on vaccine prioritization across Kenya. And this is mainly a case study that's looking at lower and middle income countries, because we noticed Kenya happens to be one of them. So why not create a model for Kenya that can be mimicked by other countries when it comes to vaccine prioritization? This was inspired by mainly currently issues we're facing in lower middle income countries, where there's issues of vaccine distribution, vaccine access to that. And you notice that some of these countries, one of the characteristics that we have even locally is how vulnerable our health system is, how there's also cultural variables that come in, people being hesitant to vaccines. There's also how equipped our facilities are, and that created the need of why not then help the government create a vaccine prioritization plan that's able to work for the country and just put in place again, which is almost similar to the previous vulnerability index we did. But now we are looking at 18 variables, which now makes it a very rich composite of how then do we roll out this plan, and how do we then create very locally responsive solutions that work for the entire country. So we are still looking at some of the vulnerable factors, and then we are adding a component of health facilities. So this means what's accessibility for these populations towards a health facility, because then that's what affects, or that's what influences if someone will go get vaccinated or not. So we've added that as an additional layer within the variables, and we are looking at now how can we be able to use these factors and for the government to just roll that out. We are hoping Ministry of Health joins in. We've reached out to them, and that's now what will inform now us going ahead with the project, because we currently have it within the pipeline. So we are hoping they'll reach out, but that's what the project is about.
I think it's really interesting just to watch the many ways that we have to begin to talk about, vaccination, because there's the myths and disinformation part of it, which, involves the media. And then there's also this really rich data part that talks about who do we actually need to prioritize when we're talking about vaccine uptake. And I'm so happy to just see all these pieces working together to get us all towards the end of this pandemic or this crisis. I don't know if there's an end, that there's a hard line, but I think to get us through and to a better position. So in your project that you're currently working on, there's a thing that you mentioned around the fact that the majority of healthcare workers are female, and that this is a factor that has to be put in mind when we're talking about vaccines. And I was wondering if you could just tease that out a little bit for us.
So what happens in the pipeline that we are creating is we are also going to include a gender component of it. So what happens is we want to be able to create a rollout prioritization plan that's able to have a gender component of it. So what we are looking at is also things like who's the head of a household, and then components like, who's the breadwinner for that specific household. What do they do? What's their occupation? If they're frontline workers, this can be healthcare workers, this can be soldiers in malls. All these components now would all be able to come in together for us to be able to know, okay, this is the prioritization plan. It also has a gender component of it that's very important currently within the country, for us to just be able to have a rollout plan that works and that's very inclusive for the entire country, basically. So that's essentially what it is. We'll definitely be able to publicize the project as soon as we go live, but the concept paper is already up, so we should be able to have a publication soon for the public to look at the 18 factors we've now included to just create a prioritization index for vaccine rollout across the country.
That is very exciting stuff, and I wish you the best on this project. So I will not keep you for much longer. I'm just going to ask you one more question. We always like to end the podcast by asking all of our guests about what their big idea is. So looking ahead, what is your big idea for the role that data or GIS technology can really play in strengthening the region's response to COVID-19 and perhaps future health crises?
I mean, for women in Kenya, I'll briefly talk about some of the components we have in the pipeline that I think would be really important to consider as a continent, as a country. And one of the things we are currently looking at, and it's a project that we are currently writing up for funding, would be the impact of COVID on education systems. And again, we are looking at a Kenyan perspective and then being able for that to be able to be mimicked across the globe. And one of the things we are changing, or what the pandemic has really changed even in how we work at Women in GIS Kenya, is now we are changing how we are creating models. So a model is something that mimics reality, and we want to sort of alter and see what that reality would look like if a couple of components adjusted. So what we're looking at currently within that particular project, which is basically mapping or understanding Africa's digital preparedness, and then looking at the response and resilience across education systems. And this was inspired around students now moving to digital learning. We're looking at primary school students, and some of the variables now we'd want to have in for us to just be able, because one of the components that came in during COVID was, again, I do a lot of McKinsey reading. So they had a survey on, in the next couple of years, most of the working environments would be online. But what happens to kids in Africa? What happens to kids in Kenya, right? Because they've already been left behind just based on this pandemic and the access to digital services and access to laptops and all this. The government rolled a DLP, Digital Learning Program, for Kenya. But now what the project is looking at is, are we saying that as long as a student or a kid has a laptop, then they are able or they're good enough to adopt to a digital learning platform? The answer would be no, right? The socioeconomic variables, the fact that you're home, these cultural values that come in. If you're a girl, maybe you're expected to do chores while the boy is learning or already following up in school. There's a component of electricity. How many households do we have access to? There's a component of internet. How affordable is this internet? How stable is it for us to be able to stay online and actually do the actual work that I'm required to do from home? And then there's education preparedness. How equipped are teachers? How equipped are parents at home to support kids who are doing online learning? So we're looking at all these components, and that's what our big idea is for future generations. Again, the idea around it would be to create a really perfect model that works for Kenya, where government can be able to alter and see, if we put electricity in Wajir, how does this affect preparedness in Wajir? Then you'd notice from the index, oh wow, there's an issue. If they have electricity but they don't have internet, or they have internet but they can't afford it, or they have all this but there's economic or socioeconomic variables or cultural variables, like a girl should be washing the house or cleaning the house or washing clothes while the boy is studying. So we're going to have a very robust index that's able to inform that, so that we ensure that kids in Africa, kids in Kenya are able to learn and not be left behind by this pandemic, which is already deepening existing inequalities. So that would be what our big idea is for the next few months, actually.
That is a very big idea, and I think it's very achievable. And that you touch on the digital divides that many Africans and many African countries and governments are struggling with, I think is really important. There's a lot of really good research and data out there that just shows that despite the fact that a majority of people on the African continent do have access to mobile phones, only a third of these mobile phones are actually smartphones. And in terms of just the impact on education that digital learning has, Mawazo itself ran a survey at the start of the pandemic last year. I believe it was in April or May 2020, where we were surveying students in higher education, students, university, colleges, and asking them about how the pandemic was impacting their learning. And so what our survey showed was that only 40% of the students that we surveyed actually had institutions that were offering e-learning, which means that there's a huge gap of people who might want to continue learning but are not able to access the infrastructure or the platforms or the devices, the tools that they need. So I think your idea is really achievable, really commendable, and I'm very excited to see what you continue to do in this area. Thank you so much for being on the podcast today, Yariwo.
Thanks, Carrie. Thank you. Thank you for having me. This was really exciting and insightful to just have this conversation.
To find out more about our guests, find links to the information shared in this episode, or to listen again, you can find us permanently on the Nairobi Ideas podcast page at mawazoinstitute.org/podcast. You can also subscribe to the Nairobi Ideas podcast on YouTube, iTunes, Spotify, Stitcher, Google Play, or wherever you get your podcasts. The Nairobi Ideas podcast is brought to you by the Mawazo Institute, a Nairobi-based research organization that is focused on female thought leadership and public engagement with research. New episodes drop once a week on Thursdays. Till then, from all of us here at Mawazo Institute, bye and keep it nerdy.